Ask Science, Coronavirus. On Thursday, January 30, 2020, the World Health Organization declared that the new coronavirus epidemic now constitutes a public health emergency of international concern. A majority of cases are affecting people in Hubei province, China, but additional cases have been reported in at least 24 other countries. This new coronavirus is currently called the 2019 novel coronavirus or 2019 nCoV. How does 2019 nCoV spread? Coronaviruses are a large family of viruses that are common in many different species of animals, including camels, cattle, cats, and bats. Rarely, animal coronaviruses can infect people and then spread between people, such as with MERS and SARS. When person-to-person spread has occurred with MERS and SARS, it is thought to have happened mainly via respiratory droplets produced when an infected person coughs or sneezes, similar to how influenza and other respiratory pathogens spread. Spread of SARS and MERS between people has generally occurred between close contacts. A close contact is someone who has been face-to-face with an infectious person for at least 15 minutes or been in the same closed space for at least 2 hours. It's important to note that how easily a virus spreads person to person can vary. Some viruses are highly contagious, like measles, while other viruses are less so. It's important to know this in order to better understand the risk associated with this virus. WHO estimates the R0, basic reproductive number, to be between 1.4–2.5, which would make the 2019 nCoV comparable to SARS and influenza. What are the symptoms? For confirmed 2019 nCoV infections, reported illnesses have ranged from people being mildly sick to people being severely ill and dying. Symptoms can include fever, cough, shortness of breath, breathing difficulties. In more severe cases, infection can cause pneumonia, severe acute respiratory syndrome, kidney failure and even death. What are known risk and prevention factors? Outbreaks of novel virus infections among people are always of public health concern. The risk from these outbreaks depends on characteristics of the virus, including whether and how well it spreads between people, the severity of resulting illness, and the medical or other measures available to control the impact of the virus, for example, vaccine or treatment medications. The risk to individuals is dependent on exposure. At this time, some people will have an increased risk of infection, for example healthcare workers caring for 2019 nCoV patients and other close contacts. There is currently no vaccine to prevent 2019 nCoV infection. The best way to prevent infection is to avoid being exposed to this virus. However, as a reminder, CDC always recommends everyday preventive actions to help prevent the spread of respiratory viruses, including wash your hands often with soap and water for at least 20 seconds. Use an alcohol-based hand sanitizer that contains at least 60% alcohol if soap and water are not available. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick. Stay home when you are sick. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. How effective are masks at preventing the spread of frequently touched objects and surfaces? Surgical masks, face masks are effective in blocking splashes and large particle droplets. Does not filter or block very small particles in the air that may be transmitted by coughs, sneezes or certain medical procedures. Face masks also do not provide complete protection from germs and other contaminants because of the loose fit between the surface of the face mask and your face. Face masks are not intended to be used more than once. If your mask is damaged or soiled, or if breathing through the mask becomes difficult, you should remove the face mask, discard it safely, and replace it with a new one. An N95 respirator is a respiratory protective device designed to achieve a very close facial fit and very efficient filtration of airborne particles. to work as expected. An N95 respirator requires a proper fit to your face. The Centers for Disease Control and Prevention, CDC, does not generally recommend face masks and respirators for use in home or community settings. However, they may be appropriate for persons at increased risk of severe illness from influenza or other respiratory diseases. What treatment exists? There is no specific antiviral treatment recommended for 2019 nCoV infection. People infected with 2019 nCoV should receive supportive care to help relieve symptoms such as staying hydrated and resting. For severe cases, treatment should include care to support vital organ functions by medical professionals. People who think they may have been exposed to 2019 nCoV should contact your healthcare provider immediately to help avoid potential serious complications and limit the spread of disease. Reporting and testing are also important tools for addressing public health concerns related to 2019 nCoV. What role might pets and other animals play in the outbreak? Do not handle pets or other animals while sick. Although there have not been reports of pets or other animals becoming sick with 2019 nCoV, several types of coronaviruses can cause illness in animals and spread between animals and people. Until we know more, avoid contact with animals and wear a face mask if you must be around animals or care for a pet. What can I do to help prevent the spread of 2019 nCoV if I am sick? Stay home except to get medical care. Separate yourself from other people in your home. Call ahead before visiting your doctor. Wear a face mask around others. Cover your coughs and sneezes. Wash your hands. Avoid sharing household items. Monitor your symptoms. Avoid contact with pets and other animals. Isolate yourself until 14 days after you were last exposed to an infectious person. Don't know if I'm too late for this talk. My question is whether there is a possibility for this strain to become seasonal like the flu. What makes the flu, with all of its types, not simply die off with a quarantine like how it happens with SARS? I would say that we do not know if this strain, if it becomes pandemic, will eventually die off. A few of the viruses that cause the common cold every year are also coronaviruses, so it is possible. The flu does not die off every year because it continues to spread at lower levels to the tropics and then the opposite hemisphere, recombining, essentially mixing through co-infection, with other flu viruses and evolving all the time. Coronaviruses are known to recombine as well. There's a lot of conflicting information about asymptomatic carriers and the latency in presentation of symptoms. What do we know about these two subjects? Do the carriers present with viral shedding for the same duration as a symptomatic infection? What is the average latency in confirmed cases? Very good questions. Singapore may be able to help provide some answers soon. Singapore currently has 13 infections, all of them mainland Chinese tourists who are being kept in isolation in 2 Singapore hospitals. All of them mingled to a greater or lesser extent with the local population before being admitted. 139 close contacts have been identified and 134 of those have already been traced and are being monitored. It is still the incubation period, but so far no locals have been reported as being infected. The next 2 weeks will be very instructive as it will show how widely this group infected others in a country they were visiting. From that we will get better idea of the virus's potential. Fortunately, Singapore has the expertise and infrastructure to get a good handle on this and provide reliable data. Update. There are now 18 cases in Singapore. 17 are mainland Chinese tourists who traveled from Wuhan, the other is a Singaporean who traveled back from Wuhan on the recent evacuation flight. There are still no reported local transmissions. What are the chances of contracting the virus in a major city outside China? The media is doing its thing and generating a lot of fear. I'd like to know whether most people here need to actually be worried about contracting the virus. Very unlikely in a developed country. Quarantine procedures are very effective and people who may have been affected are contacted or notified to watch their health. If you're in developing country it's difficult to tell, but your chance of contracting the virus is much higher because the people who already have the virus have likely not be isolated, thus you may get it from them. Overall your chance of contracting corona is quite low. Just take safety precautions such as staying away from people who seem sick. Sanitize your hands and eating surfaces. How does this compare to previous viral outbreaks like SARS, Zika and Ebola? I don't remember entire cities or regions being evacuated of foreigners, or cities walling themselves off with other outbreaks. Is this a bigger deal than previous outbreaks? It's most comparable to SARS, which was another coronavirus. Currently, it's less deadly than SARS but more contagious. It also seems to be pretty stable in humans, meaning not a lot of mutation has been observed. So hopefully it won't mutate into something more lethal. Zika doesn't spread person to person, so it's not really comparable. Edit: Zika can spread person to person through sex, but it's mainly through mosquitoes. Ebola is not very contagious but can be very deadly. Is it true that this is very contagious? I am reading that the virus size is large and droplets in the air fall to the ground or surfaces quickly, so it's not as contagious as if the virus was smaller and would stay in the air longer. Are people correct in saying this is very contagious? What is correct? The virus has a larger shedding period in an infected individual, relative to your basic common cold viruses. That means that a person infected is able to infect other people over a longer period of time. There is currently belief that someone infected with the present coronavirus is shedding the virus even before he starts having symptoms. As you can imagine, that makes the virus a lot more contagious because someone may not know they are at risk of infecting someone else. The outbreak of the new coronavirus has led to the spread of misleading videos and conspiracy theories online. The BBC monitoring team has collated a list of various conspiracy theories already circulating.